What are the preparation or procedure of IVF and how does long take it?
So first for the preparation, you need to educate yourself first that the process of the IVF. So when you know what to expect, the anxiety will reduce and you can make the right decision.
Okay.
Second, you need to prepare yourself and your mind to get in through the IVF process. And third, you need to find the right clinic for higher pregnancy chance. And for IVF will take time around 2 to 3 months from the starting ovarian stimulation until the end of the process, embryo transfer. In summarize for timeline, first we will do the ovarian stimulation given the hormone for every day like 10 to 12 days. And then when the egg is ready inside, we do the egg retrieval outside and fertilize with sperm. After that, for our team, laboratory team will monitor the embryo development for 5 days. After that, we can check this embryo that is normal or abnormal. We can do the chromosome test to check that they have a genetic disease or not. And once you get the normal one, we try to prepare your uterus, take time around 3 weeks and transfer it back to your uterus. So entire of the...
You can say that it's a long procedure.
Yes, for the entire IVF process, it takes time around 2 to 3 months, but don't worry, it's all the process is outpatient case, no need to stay in the hospital.
She can stay also at their home, right?
Yes.
Okay. So I also want to know that, as you know, that since this is a corporate era, so if any couples wants to have twins, so is it possible or can it done by IVF?
Yes, for twin is possible through IVF. For the IVF, twin can occur when we do 2 or multiply embryo transfer back to the uterus, but the result is not guaranteed because they have many choices that influence during the process treatment.
Okay. So is it possible as well triple?
I think triple is possible, but I think in a long term for the baby life it can be dangerous.
Okay, so now my question is, can PCOS or irregular period in women or teenagers can lead to infertility?
It's hard to say it can or it cannot be, but mostly it can be because when you get a PCOS, your egg is not spontaneous ovulate. Okay. When you not ovulate, you having sex is not conceived.
Is there a direct relation or indirect relation?
It's mostly direct relation because you not ovulate. So they're not something is not fine with the sperm. So it can bring you to infertility in the future.
Okay, that's great. So do you have any advice for our audience and your patients?
I think for the SY, I have many tips for you. First, you need to maintain your healthy lifestyle. Eat more vegetable, have more meat, and do exercise regularly. For the Bangladesh people, I need you to maintain in the normal weight and keep your mind well-being, do the stress management, and look for the right fertility clinic that have the high success rate. So you can bring all the success and make your experience as smooth as we can.